at least participating and being a big part of that. So my plan today is to spend some time talking to you about what's going on in the county around COVID vaccinations, the structure, talk a little bit about equity, and then spend some time talking about what our plans are in terms of multilingual communications and outreach to some of our underserved communities. I'm going to try my best to keep it within the allotted amount of time. So if I end up running what I feel is long, I'll cut it off and then allow you guys to ask questions later on. So give me a second while I share my screen. Okay, so as I said, we're going to cover at least 4 of the 5 things listed here. I want to cover the basics because I think in order to have a good understanding of what it is we're looking to accomplish and what we're doing, you have to understand some of the structure around the vaccine distribution, not just here locally, but from the federal and state level. We'll talk about the Montgomery County's COVID-19 vaccine portal, because that's the only way folks can go about getting an appointment to get vaccinated by Montgomery County's Public Health Department. We'll talk about equity, why it matters, and then talk about the framework around what we're doing and how we're going about doing it. And then hopefully I'll have some time to talk to you about pre-registration, community outreach events that we're looking to stand up, and the partnerships we're looking to form with organizations across the county. So the basics. I know that often we hear a lot about where we are as a county in terms of getting shots into arms. What you need to know that at this point, as of this morning at least, 200,159 folks had received at least their first vaccination, and over 100,000 folks to date have been fully vaccinated. So it's just over 19% have received their first dose, and just under 10 have received their second dose here in Montgomery County. That is not necessarily where we want to be, but it is not bad when we look and compare ourselves to where other jurisdictions are in the state. Now, this data is slightly dated because this was based on our numbers from over a week ago. But what you see is Montgomery County is ahead of every single jurisdiction in the state in terms of first and second doses to members of the community. All right, so this to me is as important as anything else you're going to see today, because it speaks to managing folks' expectations and giving them an understanding of how this whole process works. So as you know, the federal government has received access to 3 different types of vaccinations or vaccines, and they're distributed to the states. The states are then responsible for allocating those vaccines to counties and jurisdictions. Now, what you need to know is here in Montgomery County, we receive about 15,000 vaccines a week, 15,000 vaccines a week. Now, the Public Health Department only receives between 4,500 and 5,000 of those vaccines. So that means a third of those vaccines are coming to Montgomery County and controlled by Montgomery County's health department. The other doses are being split between the retail pharmacies and the hospitals. So when we talk about expectations and how long folks need to wait in order to get vaccinated by the county, it's important to keep in mind that we have over 180 folks pre-registered in the county system to be or to receive a vaccination, and we have in our hands weekly about 5,000 doses. That explains to you why it's taking, or it may take a little longer than we'd like it to take in terms of getting folks vaccinated. However, it's important also to understand why the county is going about it the way they are, and it's about equity, right? So what's important to understand is for both the pharmacies and for the hospitals, there's very little equity built into how they distribute those vaccines. And until recently, there was very little equity into how the state distributed the vaccines. So if I take a step back, there are 4 ways primarily that folks can go about getting the vaccine. So retail pharmacies, the states run mass vaccination sites, of which there's one in Six Flags, there's one at the Baltimore Convention Center, one at M&T Stadium, there's now one in Waldorf, and they're standing up one in Eastern Shore, and I believe Hagerstown as well, for a total of 6 state vaccination sites that will be available, if not now, in the next few weeks. And then you have the hospital systems, in addition to Montgomery County's public health system. So there are a number of ways that folks can go about getting their vaccinations. However, the only of those that has built equity into their framework is Montgomery County. And I'll tell you why that's important and what it looks like in a moment. But it's important to understand that, and anyone who's gone about trying to get an appointment, whether it's at Rite Aid or CVS, you know how difficult it is. And you know that it really feels like the Hunger Games, in as much as you have to sit on your computer all night or all day, or get up first thing in the morning at 5 o'clock in the morning to hope to get an appointment. It's really frustrating, and it's been something that not Maryland, but the county is trying to address from the standpoint of folks who are disproportionately being hit by this disease, have access to an opportunity to get vaccinated without having to race for an appointment. So let's talk really quickly about who's eligible. So we spent the last 3 to 4 weeks attempting to get the folks who are in the priority group 1B vaccinated. So that includes adults 75 or older, and then all the folks you see on the list there below. We are currently just moving into priority group 1C, and I think that officially began this week, although some groups you started to include at the end of last week. So if you are 65 and up, now you're eligible, and those adults who suffer with medical conditions are now eligible to both pre-register but also get vaccinated. So let's talk about the COVID-19 vaccine portal. The reason this is important is that in Montgomery County, the only way you can get an appointment is to go and pre-register, right? And the only way to pre-register is to visit that website there. Now, you can get language support if you do it online in 6 different languages. The languages you see there, 7 languages, I'm sorry, including English. And if you want to do it over the phone, now, officially there's language support for multiple languages, but what I will say is in reality, that line really just supports English and Spanish. So if you have folks who are looking to get support in English and Spanish or complete their pre-registration over the phone, they should use that number there. The thing that's important about this portal are 2 different things. A, it goes through the 3 steps that we want to make sure that everyone understands, but also has reminders and gives you access to important information and resources. So the first step obviously is pre-register. The second step is make your appointment. Now, you're not able to make an appointment until you receive a message from the county telling you that your time is, that doses are available first, and that you've been selected to make your appointment. Now, the email address that everyone who is selected to make an appointment receive messaging from is that C19 vaccination at montgomerycountymd.gov address you see on the page. The other thing that's important about this page here is that it gives you an opportunity to sign up to receive email or text message updates. So it'll tell you when the various groups are eligible to pre-register or eligible for their vaccinations, and any other pertinent updates that the county's health department thinks that you ought to know. So that's the second thing that I encourage everyone to do. If you've already made an appointment, or if you haven't made an appointment, please sign up to receive text messages or email updates. Third, the next step is to get vaccinated, right? And you obviously, there's some information you need to know about what to expect when you are going to get vaccinated. And I wanted to share some of this here because I think it's really important for folks to know. So if you have folks who you're serving, or or even family members, you know what to expect and what you can share, right? So the very first and most important thing is that it is free. There's no cost associated with any of the vaccines, all right? Second thing is we need to encourage folks to be patient, especially with the county system, because the county system, again, is trying to use this framework that builds equity into how folks are selected, which means that it may take a bit more time than if you run to CVS to register there. Now, I guess it's really important for me to say, we're encouraging everyone to register in all the places that the vaccine is available, right? So you should register at any of the pharmacies that have the vaccine. You should register in the hospitals if possible, and you should try the state vaccination sites. But it's important to understand that when it comes to how you go about getting those appointments, it is only based on if you time it correctly, or if you have a connection who gives you the information as to when they're becoming available, or if you just happen to get lucky. Other things that folks need to know when preparing for their vaccination is what sort of ID they need to have. Now, this is obviously something that's become relatively important over the last few days because of what we've heard about in the news. So originally, ID was that you should have either a driver's license or Maryland identification card, passport, or work ID. But the reality here is the county is not concerned at all with anyone's status, right? So we are attempting to get as many folks vaccinated as possible, and status does not come into play here in any shape, form, or fashion. The reality is the county will likely take a bill that has your name and address on it, just to confirm that you are who you are. You say you are, and you actually reside here in Montgomery County. Really and truly, that is the most important thing here, and it's important that folks understand that status is not a factor when it comes to getting vaccinated here in the county. Lastly, the resource on this page is really important, relates to how you can go about getting appointments in some of the other ways. So if you go to that page, you'll see a list of all of the hospitals, a number of the retail pharmacies, and it provides links and how you can sign up to try to get an appointment in any of those other places, as well as the Maryland state vaccination sites. So that's a resource that I encourage everyone to use or to share with your community or the folks that you're serving regarding how folks should go about getting an appointment. So let's talk really quickly about equity before my time runs out. So let's look at this map here. This map is really important to understand. What you see here is a map of Montgomery County split up into census tracts. In the green are those portions of the county where you have folks who are over the age of 75, who are pre-registered in numbers that exceed the actual population of folks who are 75 living in that community, right? And then what you see in the orange and the red are communities that are under-registered or under-pre-registered for the vaccination. Why this is problematic is there is actually also, if we were to take this map and look at those communities that have been hardest hit over the last 3 months or all time, those actually happen to be those communities that are also most affected by COVID. So it's an unfortunate set of circumstances that we're looking to address. In order to do that, we try to build in this equity framework. So what you see on the map in front of you is those communities that have been prioritized based on the COVID rate, the mortality rate, and the population that have been disproportionately affected by COVID. What that means is if you have a community that has twice as many African Americans or Latinos that are hit by COVID, then they're gonna get twice as many appointments for that day to get vaccinated. Because it seems only fair that if you're being disproportionately affected, you should get an opportunity to get vaccinated at a rate commensurate to that. This is only important because it gives you an idea of the demographic breakdown of those folks who live in this community or in this county, especially those 75 plus. And why I want you to take note of this really is because those folks who are 75 plus from the, who are either Black, African-American, or Latino make up about 19% of the population, right? Why that matters is when you look here and see how folks have either pre-registered, been vaccinated, and they compare that to how they've been, the number of COVID cases within that group, you'll see that unfortunately, you have the Latino community or Hispanic community that's at 40% all-time cases, but unfortunately, just 6% have pre-registered and only 5% have actually been vaccinated. And you have similar startling numbers for the African-American community. And this is why it's really important that our office is engaged in attempting to get these folks not just pre-registered, but provide them with the information necessary to get access to these appointments, and why the framework for equity is in place. The other thing that I think you should see here, and I guess it's equally as important, if you look at where folks are going about getting their vaccinations, you'll see that by and far, the Hispanic community has been dependent on Montgomery County's Department of Health and Human Services to receive the vaccination, as opposed to getting it from one of the pharmacies or the local hospitals. And other communities have been a bit more successful in getting vaccinated in some of the other places. So when we talk about equity and ensuring that folks who have been disproportionately hit by this disease or this pandemic, it's important to understand that this is the reason why we're engaged in the work that we're engaged in. I'm running out of time, but what I want you to know is our office structured what we're doing now around what we did for the 2020 census, right? So we're communicating in 7 different languages. We're partnering with organizations so we can address that trust barrier. One of the building blocks for what we did for the census is be really dependent on those organizations who had existing relationships in the community to share that information and also help to get those folks to feel comfortable with, in this case, pre-registering, but in that case, filling out the census. Some of the things we're also engaged in are town halls. You'll see us with multiple posts on social media trying to address people's concerns around hesitancy and just providing consistent information and coordinating our efforts, not just internally within the county, but across those partnerships that we had formed around the census. For those folks who want to get engaged or help us with this work, whether you remember this or not, we formed this complete count committee for the census, where we invited the leaders from our faith communities, business communities, nonprofits, and whoever was interested to help us formulate that strategy and doing this outreach and this communication. And then we broke that into 5 regional groups that really focused on targeting those communities at a granular level, on a block or neighborhood level, in terms of determining what, for example, faith community existed on this block in, let's say, in Long Branch, that could serve as a partner in our outreach and trying to get that community to feel comfortable with the census then, but now provide them information for how to go about getting vaccinated and what information they should trust and what they should understand about this process. So that's really what we're doing here. We invite anyone interested to join us in one of the 5 regional service centers, if possible. I'm gonna stop there because I feel like I'm running out of time, and I'll answer any questions about what the community outreach will look like and what the multilingual assets we are developing at this stage are going to be. But I will be around for questions.
Thank you, Shawn. Sorry. Thank you. And MCAEL was also part of the complete count at the Silver Spring one. And the reason why we're doing that is so that we can have accurate and timely information that we can share out with our network. Rudy, do we have any questions in the chat?
Yes, we do have one from Tabui at Association of Vietnamese Americans. She is asking about, for those who don't speak English or aren't able to use computers or don't have emails, can we use our emails to register for them?
Yes, that's a really good question. So we are encouraging anyone and everyone to help neighbors, friends, families pre-register for the vaccine. If it means that you are comfortable sharing your email address or being the point of contact for that person, we do encourage it. We just hope the responsible people take on that role, so that because they're really dependent on you to share with them timely information around when they should be signing up for their appointments or arriving to their appointments when they've been created. But yes, you can certainly assist members of the community however and wherever possible, including using your email address or phone number if necessary.
Thank you. I think, Tao, you had another question about frontline workers and whether nail technicians and barbers are considered frontline workers. Do you know the answer to that, Shawn?
That's a good question. It's slightly above my head, but I can get back to you on whether or not they qualify now.
Okay, thank you. That was all in the chat. If there are any other questions, please let us know.
Thank you. So we're going to move on to our second speaker. I'm going to share my screen. Our next speaker is Sharon Strauss. She is the Executive Director of Community Action Agency. Welcome. We have the same format. Please introduce yourself a little bit and then.
Okay, well, thank you so much for having me. I am Sharon. I'm the Executive Director of the Community Action Agency, which is part of HHS, Office of Community Affairs. And we have partnered with Gilchrist for many, many years, and until recently actually delivered a free tax help at Gilchrist. So today I'm talking to you about the VITA program, and that stands for Volunteer Income Tax Assistance or Free Tax Help. And we actually started the services in the 70s at the Test Center. You may know that Test was the county's first bilingual center that really designed to serve the growing immigrant community that was very concentrated and still is in Long Branch. But now VITA is throughout the county. And so, yes, VITA stands for Volunteer Income Tax Assistance or Free Tax Help. And we have a couple of county staff and many, many volunteers who join together. They're IRS certified to serve residents who earn $57,000 a year or less. And so the goal of the volunteers is to make sure that the taxpayers receive all the credits that they're eligible for, and to help them become more knowledgeable also about the tax laws and also the resources that are available in the community. So when people come in, if they have other needs, that's also a chance to connect folks out. So VITA targets people who are eligible for the EITC and really focuses on limited English speakers, seniors, people with disabilities. And you may have seen the ride-on buses that go by. We have a multilingual outreach campaign that is connected flyers and ride-on messaging at our cashback website. And I'll add that in the chat when I'm done speaking. We also have a text campaign this year that is building upon the model that the Census Full Count Committee did, which is targeting the hardest to reach communities, 33 households in neighborhoods with high numbers of low income and diverse communities that are there. And that was to give them the opportunity to book appointments quickly, along with people who have known about our services for many years. It's really important because one of our main goals is to help people know about the Earned Income Tax Credit, which is structured to help working people who are low and moderate incomes. And the way it works is it reduces the amount of tax that people owe, and then there's additional refunds on top of that. And so there's over 50,000 households a year that file for the EITC. The average federal credit is $2,500 or so. Maryland has one of the most generous EITCs in the country, and Montgomery is one of the only local jurisdiction that does a match. And that's really making it very, very powerful because it amplifies the financial power of it. So every year, 1 in 3 filers is newly eligible, and we know that people leave money on the table because between 25%, 20% of people never file at all. So we really are glad to have this chance to get you on board so that you can encourage people to participate. And so you do have to have earnings, and then the credit is higher for people with the lowest incomes and the most children. So it cascades down as people's earnings drop or with smaller families. So that's how it's structured. There's been a lot of research that shows how EITC encourages work. It reduces poverty. It's actually the largest, most effective program nationally that reduces poverty for children. It helps families meet basic needs. They spend the money locally. It improves children's achievement and increases their earnings, and has been shown to improve health outcomes, including for infants and their and pregnant women. So one thing is that taxpayers and their dependents do need a Social Security to receive the EITC, but there are other credits like the child tax credit that only require the children to have socials. Now, also, we know that if you earn money, you're required to report your taxes, and people do that through an ITIN. And that's super, super important. Actually, our VITA program is the largest free tax program for ITIN filers in the entire state of Maryland. And right now, because of the pandemic, we serve people with ITINs, but after the pandemic, when we see people in person and need to examine documents, we can actually help people apply or when they file taxes to submit their documents for the ITIN. So that's called a certifying acceptance agent. And we're one of the only organizations, I think, in the county that does that. Now, Maryland just actually passed some new laws. You may have heard of the Relief Act. And part of the Relief Act included what is an EITC expansion, which is this year and the following 2 years, which bumps up its impact. And there's also a higher amount of EITC for filers without dependents. So I think a lot of times people think of the EITC, they think of kids, but you need to remember that single people file it too. I have a son with a disability. Oh, I don't know if I should say that publicly, but anyway, it's been really important for him because he doesn't make a lot of money, and it really has helped bump up his take-home resources. So now there's also, I mentioned, we have a local version of the EITC, which we call the Working Families Income Supplement. And advocates, including CASA and Capital Area Food Bank, and of course our very own Community Action Board. Hi, Laura Irwin, former chair. We're hoping that that funding locally will keep pace. We think that's a really important part of that equity conversation, and are waiting to see what the budget will unfold. That's coming up. I should say our appointments are full. This is true for really every provider throughout the state that is taking appointments. Besides us, RSVP, I know they're full. They of course are the AARP program that also is volunteer based and works with seniors. I asked for an update from CASA. I don't have it, so I don't know what their services look like now. What they're doing. Community Tax Aid wasn't able to get into the libraries this year, but they are doing virtual services and they are a partner. And the Chinese Cultural Community Center is also a VITA partner. I don't have a status report for them. So we could have cancellations because people can go to our website, which is montgomerycountymd.gov/cashback, or to check. People can self-schedule, case managers or friends or family members can help schedule, or you can call the VITA line, which is 240-777-1123. We have 3 schedulers working that line, and yet it's always busy because we just get dozens and dozens of calls. So, we encourage people to leave messages and to be patient. Now, the process this year has been virtual. It's by Zoom. So there's an intake appointment. People upload documents. They are then scheduled to, they review that with one of our specialists, and then they have a certified volunteer who prepares the return, and then they meet at the end when their tax return is going through what's called a quality review to make sure that everything's on point and so forth. So I mentioned we're full, and so the outreach that we're going to continue to do will focus on 2 things. One is how to connect with the IRS free software, which can serve people who make more money, up to $72,000 a year. That's called free filing. And also how to choose a paid preparer, because sadly to say, we see people that spend $500-600 getting their taxes prepared, and they can end up with big problems, which we can help after the season ends from June to October. We do back your return. So that would be the years 2020, 19, and 18, and also amended returns if there are mistakes. And if people need legal help, which is out of our scope with taxes, there are some tax clinics that are with different partners that they can be referred to. Now, I should say, I actually don't know that much about taxes. My background is in human services and early childhood services, but I love this program because I know families can't thrive if they don't have money. So that's like so important. And I want to mention that we are really grateful for the outreach that you all provide. Last year, we do a survey every year to get more information about who uses our services. And of the 1,200 or so, I'm guessing people who answered the survey, 521 households were African American or African Caribbean, 410 were Latino, 79 were AAPI households, and 257 were white. So we think we've hit the equity nail on the head in terms of making sure people have access, and in recruiting a diverse pool of tax preparing volunteers, and using the language line and every tool at our disposal to make sure that people get the help that they need. And we're super duper grateful to Gilchrist for being our partner. And I guess if people have questions about, what people should bring, all of that is on our website. You could look at that in detail. But also remembering that some households will be surprised because the unemployment, there is a federal tax liability for that. Maryland's Relief Act passed over that. There's some special benefit for that, where if people who are earning under $75,000 as an individual or under $100,000 as a household, they can subtract their unemployment earnings from the Maryland return. Having said that, because those changes were really late, the comptroller and the processing for those state returns is going to be late. So the order that people can expect to see a refund would be the federal government, then the state government, and then the Working Families Income Supplement is processed usually in the summer. So that's my blurb.
Sharon. Thank you. Do we have any questions in the chat, Rudy?
Well, there was one that it had to do with unemployment. Again, Taobui. I have noticed that many didn't get their EITC because of unemployment they received. So I think you just mentioned that.
Right. And again, the Maryland returns, from what I understand, have not been processed. When the next person speaks, I'm going to add a fact sheet that will give you a little more information in the chat.
Thank you.
Thank you.
We're also going to be sharing some of the links that are in the chat in the follow-up email that we send. Thank you, Sharon, for being with us today.
Okay, thank you.
You're welcome. We're going to go to our next speaker, Sophia Yoon. She is the program specialist at the Asian American Health Initiative. Welcome.
Yes, let me share my screen. Okay. Hi, my name is Sophia Yoon. I'm a research coordinator at the Asian American Health Initiative program. And today I would like to introduce AAHI resources, especially COVID-19 resource guide and mental health videos. So before I start, I just want to briefly let you guys know about AAHI. AAHI is committed to building a healthy Montgomery County communities. Our mission is to improve the health and wellness of Asian American communities in Montgomery County by applying equity, community engagement, and data-driven approaches. And here are some of the work we did during the pandemic. And we conducted Asian American Town Hall meeting on COVID-19 vaccine distribution in Montgomery County. help community with the COVID-19 vaccine pre-registration, provide educational presentation on the COVID-19 vaccine pre-register information, provide support to the food access call center, and assist Asian community members on the food resources. Also provide translation support with various county information such as flyer, forms, and vaccine pre-register videos. And we developed COVID-19 and mental health video series, which I'm gonna talk a little bit more during my presentation later on. And we also conducted small business outreach. Actually, every year we conducted our small business outreach. Before the pandemic, we actually went to each store, visit the store and provide information. But since the pandemic this year, we actually called over 200 small business in the county and spoke to either the store manager or the owner and provide the COVID-19 resources and small business grant information as well. And we also actively send out resources and event information related to COVID-19 to the community. So what is AAHI COVID-19 resource guide? We have developed COVID-19 resource guide to support county residents in identifying resources to address various needs posed by the COVID-19 crisis. And you can actually find this resource guide on our website. So I just captured the first page of our website. When you visit our website, you can find the resource guide right there. So this resource guide actually covered 9 different resources. So COVID-19 testing, COVID-19 vaccine, healthcare coverage, food access and housing, especially like rental assistance program, employment and financial assistance, mental health, senior and caregivers, and other multilingual resources. So this is the actual resource guide. I just want to show you the example. So as you can see, we create the resource guide. We divide the resource guide by resource, description, website, and contact information. So under the resource, you can find all different kind of the program, and then you can find a little bit of the summary about the resource, and then we also add the
I think she might have been disconnected.
Here is our, and here is our COVID-19 and mental health video series. So far we have 10 COVID-19 mental health related topic video. Those are the videos, like 3 to 5 videos in different languages, English, Chinese, Hindi, Korean, and Vietnamese. And the topics are managing your stress, guided to self-care, coping with grief and loss, maintaining social connections, dimension of wellness, guidance for all the adults, reducing stigma, building resilience, staying active, impact on domestic violence. And those videos cover topic, challenge, and impact on mental health, of course, the guidance tips, and then resources as well. And you can find those videos on our YouTube channel or our website as well. So I actually captured the, one of the, video on our YouTube, just, you can see. So this is the video about the COVID-19 reducing stigma video. As you can see, you can find the English, Vietnamese, Korean, and Chinese and Hindi videos there. So you can click and watch the video. And I also want to introduce about our photo novel as well. We have 6 different photo novels, and these photo novels were developed to address specific mental health needs for the Asian American population. You can find this photo novel on our website also, and these are also available in 5 different languages, English, Vietnamese, Korean, Chinese, and Hindi. In 2015, we developed our first photo novel that introduced mental health and highlighted the signs and symptoms of a mental illness. And then in 2016, looking at the general population, Asian American adults also have the lowest mental health service utilization and high mental health service termination rate. So therefore, photo number 2, we provide information about what the therapy process look like. And then the photo number 3 and 4, we try to provide the information on adolescent mental health. So we focus on some of the unique cultural challenges in the Asian American adolescent population and resources to support them. And then our last 2 photo novel, we focused on older adults and caregivers, knowing that Asian American are the largest, like 65 and older minority population in Montgomery County. Also, our intensive research, we identified loneliness and social isolation to be, a issue in the Asian American older adults. So this photo novel raised awareness about this issue and highlight some of the, available resources for the seniors and caregivers. And we also have mental health toolkit. These toolkits are meant to provide community members with ready-to-go presentation. So they can use this toolkit to actually conduct their own mental health workshop. So we currently have 2 toolkits, one that introduces mental health and dimension of awareness, and the other one that discusses how to seek care for your mental health. So those are the toolkits you can also find on our website as well. In AAHI, we also provide service connection to the community members, so we can help navigate and connect with the services in the county and guide the community member through the process to connect to different service areas. So for example, if community member is looking for information on COVID-19 vaccine pre-register process, we educate them about the vaccine pre-register information, but at the same time, we make sure they can pre-register and get connected with the services as well. So here is our contact information. My personal, my information, my email and my work cell, and also our main office and the email address as well. So if you guys looking for any resources or have to connect with any resources, contact us. And also we have social media, Facebook, YouTube, and Twitter, and our website as well. So please come to visit our social media as well. That's all. Any questions?
Thank you. Rudy, do we have any questions in the chat?
Well, there was one question about your photo novels and whether you have plans to make one on COVID, and the observation that these would be great to use in ESOL classes.
Okay, yeah, I can definitely, pass that information to our mental health coordinator. Yes, I'm not exactly sure about what will be our next photo novel, but I can definitely find out more, and then I can share with you guys, about the information as well.
Thank you very much.
You're welcome.
I think that's all the questions.
Thank you, Rudy. Thank you, Sophia, for being here with us. We're going to get into our next presenter, Suzy Mendez from Mobile Med. Thank you for being here with us and welcome.
Hi, everyone. I'm Suzy. I'm the Outreach Engagement Specialist. So I wanted to briefly discuss Mobile Med. Our mission is to improve the health of low-income people who face the greatest barriers to care access. I'm going to discuss our primary care services and the assistance that we provide with enrollment. So general primary care. Mobile Med provides all its patients with a full array of primary care services. including physical exams, preventative screenings, chronic illness management, sick visits, blood pressure check, cancer screenings, and behavioral health. Primary care includes navigating patients to other services, which include no-cost mammograms, labs and imaging, arrangements for no-cost or low-cost medications, and specialty referrals. So we're all about healthcare access for all. So it's care regardless of their immigration status, low-income adults in Montgomery County. So copay caps at $40 and is set at $25 for patients with an income level that is less than 100% of the federal poverty level. This copay would include physical exams, labs, screenings, and so on. And we have bilingual staff. Some languages spoken would include Spanish, French, Amharic, and Korean. And we also provide help with enrollment in Medicaid and in private insurance plans through Maryland Health Connection, and help with enrollment in Medicare. So some of our locations would include our Up County Clinic, which is in Germantown, our Silver Spring Clinic, which is in on Briggs Cheney Road, and then we also have a clinic in Rockville. We also have van locations, but they're temporarily suspended. So usually we would have them in Aspen Hill, in Tacoma Park, and then in Gaithersburg. Basically, no referral is needed to establish care, and you can call to request an appointment. If you or anybody that you know needs primary care at a lower cost, please let them know that we're here to help, and to call that number right there. Thank you.
Thank you. Do we have any questions?
May I ask a question?
Yeah.
Suzy, of the 3 locations that you have now, are different languages spoken in each of those places, or are there like certain language spoken at some of them?
No. So for the most part, all these languages are spoken at each location. The location in Germantown, they do have a special slot for Korean-speaking patients. So, but for the most part, you would be able to get languages at all of our clinics.
Thanks. And Rosa has asked in the chat whether people would be getting the slides, and yes, we are planning to follow up with everybody's slides after this meeting. I think that's, anybody else have any questions? No?
I do want to thank all of our presenters today. As I mentioned at the beginning of the meeting, you know, with learners, it's not just literacy that matters. They're full human beings who have different needs, as all of us. So we hope that this meeting and the information that was shared is useful and helpful for you to pass it on to your instructors, to other program staff, and also to the learners. I'm going to share in the chat our survey. We do want to continue to make these meetings meaningful for our coalition members. So please take a moment to complete the survey. It should take about a minute or 2. And as Rudy said, we'll be sharing all of the slides as well as all of the links that were shared through a follow-up email.
If I might, I also just wanted to mention about Gilchrist Centers. They have a service now. Anna, I think, is on the call. I don't know if you wanted to speak.
Hi, thank you. Hi, everybody. Well, we just want to remind everyone that, or let you know if you weren't aware, but since the pandemic, we have had our phones open Monday through Friday, 9 to 5, to answer questions about any of these topics that have been addressed today. We can help people connect with whatever types of resources, including food, healthcare, testing, COVID testing, and also COVID vaccine, housing and eviction. We can help people clarify their questions about public charge, immigration, connect with a legal assistant, help make an appointment for taxes, And then, of course, we always have our classes, our online classes in English, computer, basic computer skills, and citizenship. Our staff are multilingual. If the person connects with someone who doesn't speak their language, will use the language line. And people can also leave a message and we'll call back, or if they put a note on Facebook. And that infographic is on our website, which I'll put in the chat. And it's in all of our key languages. It's in English, Spanish, French, Vietnamese, Amharic, Korean, and Chinese. I think I got them all. And but please encourage your clients to call us. You know, that's what we're here for. We are a county agency, and it is our role to help people beyond what they can get at 311. So some folks may know that they can call 311 for a quick answer to a quick question. Our staff will do the research, and if it takes 20 minutes to help them or more, if they need to call them back, they will do what it takes to connect with them with what they need. Thank you very much.
Thanks, Anna. I've gone ahead and posted that in the chat.
Oh, thank you.
Thank you, everyone. And I see that someone just completed the survey, so thank you so much. I received the notification. I think with that, we will be closing. Rudy, do you have anything to add?
I don't think so, unless anybody would like to make any announcements. Okay.
Thank you for being here again with us this afternoon, and enjoy the rest of your day.
Bye.
Thank you.
Thanks.
Bye.
Good to see everybody.